You're watching Reality Check. Mounting new evidence suggests that India's COVID death toll could be double, if not more, than the official figure. According to the official estimate, over 3.7 lakh Indians have died of COVID since the first wave, but just on the basis of data from just 5 states, it appears that the real quote-unquote death toll may have already hit 8.5 lakh deaths, more than double that official figure. Just look at that number, 8.5 lakh deaths alone just from 5 states. Let's explain how. At first, the undercounting of the deaths was exposed by the media and others, comparing figures at crematoria in Indian cities and districts with the official COVID toll to bring out the discrepancy. But now, thanks in large part to the work of data journalists like the Chennai-based Rukmini S., more comprehensive numbers of the massive undercounting of possible COVID deaths is beginning to emerge. By comparing government death registry data in a normal year versus the death registered during the pandemic year, to find huge numbers of possible COVID deaths not captured by the official count. So far, this death registry data has emerged for 5 states: Tamil Nadu, Madhya Pradesh, Andhra Pradesh, Gujarat and Delhi. And just these 5 states are pushing up the numbers in such a significant way. Let's just look at this chart to give you a sense of the huge gap between the official count and the unofficial. Madhya Pradesh, 4,500 official COVID deaths, unexplained excess deaths 1.77 lakh. Andhra Pradesh, official deaths 3,800, unexplained excess deaths 1.2 lakhs. Tamil Nadu, the official count 17,400 deaths, unexplained excess deaths 92,000. Karnataka, official COVID deaths 20,900, unexplained excess deaths over 80,000. And in Delhi, official COVID deaths 13,200, unexplained excess deaths 6,400. This is period between 2019 versus 2021, with the source being the civil death registration system accessed by Rukmini S, amongst others, also sourcing from the municipal corporations of Delhi as well as the Karnataka government. Let's just break it down state by state for those who want a little more detail in how these numbers have been arrived at. So in Madhya Pradesh, between January and May, deaths reported in 2019 in a normal year 1.7 lakh deaths. Deaths reported in 2021 3.5 lakh deaths. So the excess is 1.81 lakh deaths. The official count in 2021 in this period was just 4,600. That's why the unexplained excess deaths is 1.77 lakhs. Similarly, in Andhra Pradesh, during the normal year, quote unquote, in 2019, 1.5 lakh deaths. Deaths reported in 2021, 2.7 lakh deaths. Excess, 1.3 lakh deaths. COVID official deaths is 3,800. So the unexplained deaths are over a lakh. Let's come to Tamil Nadu. Again, in the quote-unquote normal year, deaths reported in 2019, 2.9 lakh deaths. Deaths reported in 2021, 4 lakh deaths. Excess deaths, almost over a lakh. Official COVID deaths, 17,400. So the unexplained deaths are 92,000. Coming to Karnataka, again, look at that. Deaths registered in 2019, 2.2 lakhs. Deaths registered in 2021, 3.2 lakhs. So the excess is a lakh. Official COVID deaths to 20,900. So the unexplained excess deaths is over 80,000, 4 times as much. Delhi, again, death certificates issued in 2019, 18,700. Death certificates issued in 2021, 38,000. So the excess deaths are almost 20,000 deaths. Official deaths in Delhi were 13,200. So the excess deaths or the unexplained excess deaths are 6,400. All right, joining me tonight on Reality Check, we have with us Dr. Shahid Jameel, one of India's most respected virologists, Director, Trivedi School of Biosciences at Ashoka University here in Delhi, Professor Girdhar Babu, Professor Head Life Course Epidemiology, the Public Health Foundation of India in Bangalore. But let me start with Rukmini Srinivasan, Chennai-based data journalist. Rukmini, terrific reporting by you on this. You've doggedly stayed with this story. And I know that when we are adding these up, this is not an exact, statistical exercise. These are just simply the raw numbers thrown up by the work you and others have done. But just look, Rukmini, at how staggering that figure is already looking, that we're talking over 8 lakh possible COVID deaths just from these 5 states.
So they are staggering numbers. And I think one of the places where I feel my work stops and the work of people like Dr. Babu and Dr. Jameel takes over
Yes.
is in estimating what proportion of these excess deaths are from COVID.
Yes.
That's something that I won't hazard a guess for. I suppose from a broader public health and democratic perspective, the fact that there were so many extra deaths is alone a huge tragedy. And I think there's been a lot of partisan sort of hair splitting over how much of these are COVID and not.
Right.
So I think it's useful to also refocus on the fact that whether directly from COVID or from the health system being affected by the pandemic, there
Right.
has definitely been a huge rise in mortality. That's what I'm most focused on.
But also just quickly tell us, before I go to Dr. Jameel and the others with exactly those questions, that just this data itself, this civil registry of the deaths and births, now getting access to it, were these databases always in public domain? Because some states are public, some are not, and it's been quite difficult to get that data. Were they always all in public domain, or has there been some attempt to try and, I don't know, like take them out of public domain during this time?
So actually none of them are in the public domain, and they haven't been so far. I think typically what has happened is that the government produces a report on mortality sort of 2 years delayed, and that's
Right.
never been a problem. We've never even demanded faster data. But now that I know, having access to it through sources, that this data is available up to date, I think the onus is on the government to be nimble enough to turn around what would have in the past been a very slow moving process and produce this data in the public domain quickly. And just
Right.
to remind why it's important to produce this data, when after I've put these stories out, a number of people have reached out to me about deaths of their relatives that they know were not recorded. So just to give the dead a dignified end and recognize the pain of these families, that ultimately is what these statistics mean.
Okay. Dr. Jameel, let me just begin by asking you, when you look at these numbers, again, just we can try and put up that graphic which shows the meter pushing us from over 3 lakh deaths to close to over 8 lakh deaths. Does that surprise you at all, or we've kind of always suspected this all along?
Yeah, Vasu, I don't think it surprises me, but before that, let me commend Rukmini for the fantastic work that she's done. I'll come from another angle. If you look at the rate of natural deaths in India, the natural deaths in India are reported in 2019 to the World Bank by the Government of India amounts to roughly 27,000 deaths per day of natural causes. Now, if at peak India was pulling only about 4,500 deaths per day, that's barely 15% of the natural death rate. You will not see the kind of mayhem that you saw in crematoria and burial grounds if the addition was only 15%.
Right.
So just going by that logic, I mean, Rukmini has put numbers to it, but just going by that logic, you would think that unless, the capacity doubles, you're not going to be seeing those kinds of things.
Right. So in other words, to put it in simple terms for the ordinary viewer, these huge excess deaths that we're seeing are most likely to be COVID deaths?
Well, it doesn't matter whether these are COVID deaths or not. They were caused because of COVID, because hospitals were full of COVID, and somebody who had a cardiovascular disease couldn't get to a hospital.
Right.
Somebody who needed dialysis couldn't get to a hospital.
Right.
So it doesn't matter. And so let's not do that hair splitting whether it was COVID death or not.
Yeah.
Point is, a death is a death.
Okay.
For whatever reason.
Right. Dr. Prabhat Jha is also joining us, Director of the Center for Global Health Research at St. Michael's Hospital, University of Toronto, and he's actually been involved in a long running project to map fatality or mortality in India. Dr. Jha, again, as I was saying in my introduction, so far we were getting data from crematoria, comparing it that was slightly more piecemeal. Now, with this death registry data coming out, the numbers have just skyrocketed, Dr. Jha. And while Dr. Jamil says, and perhaps rightly, that we shouldn't be hair splitting, is it COVID or not? But look at what it's already doing to India's fatality rate, because India has always been saying we have a low fatality rate. Now our fatality rate has doubled from 1.3, it's almost close to 3%. That's amongst the highest in the world.
Yes, I think I also congratulate Ms. Rukmini and team for marvelous work to reveal data that should have been in the public domain. But you have to look separately at the urban areas where deaths are registered, and therefore you can use the kind of registry approach, which is how many deaths registered in these recent months versus last year, for example. That's a very robust method. You have to separate that from the rural areas where most deaths are not registered and remain unreported. So of the 10 million deaths, the 1 crore deaths in India that occur, 70 lakh occur in rural areas.
Right.
And in rural areas, what is urgently needed is for a survey or the sample registration system that the Indian government has to go back in the field and find out how many deaths have occurred in the rural areas. Because yes, as striking as the total seems to be, it might still be a low estimate. Now, the question is obvious. Why do these deaths matter? I mean, obviously, we have a moral responsibility to recognize those that have died and their families suffering. But they matter because they provide a map out of the pandemic. By identifying the areas where deaths are common, it also suggests community transmission is probably common.
Right.
And pairing that with the case data, India could develop which are the hotspots where vaccinations or other efforts should be accelerated.
Right.
It's important. These things are not just useful for very credible epidemiologists like Dr. Babu, Dr. Jasmil, and others. They're important for a map for the Indian government and the state governments to walk out of the pandemic.
Sure. That's the point, Professor Girdhar Babu, that apart from just the, just the kind of the statistical level to discover so many deaths, why is it important? And to that extent, isn't it frustrating that it's so hard to access this data, and also the fact that, okay, when you say that, government says we're not fudging data, you can still understand that if it's a couple of thousand or 100 deaths. But here we're talking of lakhs in terms of the discrepancy. I mean, just look at Madhya Pradesh. Unexplained excess deaths are almost 1.7 lakhs. The official COVID death count is just 4,500.
Yes, this is a very important aspect to understand. Let me just begin with the Madhya Pradesh example. The reported deaths per million is 53 in the Madhya Pradesh state. Now just compare that with Karnataka, that's 294 per million. Even in the way we report the COVID deaths, there is a lot of heterogeneity within the country. So first thing we need to do is get this standardized definition in terms of what is the minimum number of deaths that each should be looking at. Second, even within a state, we should be looking at both registration of death and medical certification of deaths, as Dr. Jha clearly said, by establishing through verbal autopsy. 1 in 4 deaths are due to cardiovascular diseases, Mr. Srinivasan. So what would happen in normal course is whether they got treatment or not, whether they reached the hospital or not during COVID time is as important as whether the COVID-19 infected person is getting treatment or not. So right now, I think we need to be doing 2 things. One, top-down approach of reviewing the data clearly with clear standardized definition. The other one is bottoms-up approach in terms of understanding what is the community level distribution of the deaths, where the underreporting is more. Currently, there is a sense of fear, and that's why people underreport. That fear has to be replaced by educating that this is most important.
Fear, when you say sense of fear, who's fearful? You're talking of the state machinery, government officials?
I have worked with the public health system for nearly 2 decades. Generally, the first person who wants to report always will have to, fight against a lot of odds. Let's say one system generally underreports. Now, there is a new person who wants to report deaths
Right.
then the entire system around it is having different culture. So that's the reason I said we need both top-down and bottoms-up.
Okay, you need both to.
Strengthens the transparency.
Right. But Rukmini, the fact is that even though these numbers are coming out, we've not seen any sort of serious response from these state governments. Some state governments have been doing a kind of backdated retrospective adding of death numbers. We've seen Maharashtra and Bihar doing that. They've cumulatively added about 25,000 deaths in the past few days. But other states, I mean, including I saw, reading your reports, you were reaching out, they're not really coming up with explanations or answers for this.
Yeah, so a couple of things. One is that I do think that we should commend states that are doing this audit. I mean, I think the typical media response is to say, express shock at this large number of deaths that come out through audits. But the very fact that the state is putting this system in place is something that should be commended. And I think that speaks to what Dr. Babu was saying as well. In terms of the reaction from governments, I think one of the problems is that it hasn't become a big issue across the media. The Madhya Pradesh article, for example, was not widely picked up across the Madhya Pradesh media. And, part of the reason that I think that focusing on civil registration is important is because this is data that we should be rightfully asking for. And I think the broader issue is that the public pressure on the government to release this information is not something that various arms of civil society have done a good enough job of so far. We haven't managed to make it an issue that governments feel that they have to put this out.
Right. Even though, as we've all been seeing and reporting, that you have this terrible scenes at crematoria, you've got bodies floating in rivers, and even then there's this kind of almost a kind of obfuscation. But Dr. Jha, coming back to that important question, which Dr. Jha brought up as well, that why is these numbers important in terms of our being able to understand the scope of the virus? How does it change up, what we understand of it so far, if these numbers are indeed that high?
Well, I mean, accurate numbers are required for planning, and as Dr. Jha very rightly said, it gives us a way out of the pandemic. Where do you vaccinate? Where do you put more resources? Where do you put less resources? All of those things will depend on these numbers. If you can't measure it, you can't deal with it. It's the old paradigm, and you need to measure it, and you have to measure it accurately, and you have to make those numbers available. All the wisdom of analysis doesn't lie with the government machinery. There are many competent people who work outside the government machinery who can do the analysis and who can provide insights. And sometimes those insights may be very valuable to solving the problem at hand. So I think we have to recognize that. And in India, there is no dearth of talent. But if data is behind several layers of how does somebody sitting in Ashoka University or PHFI or Indian Institute of Science, if they don't have access to data, how will they do the analysis? And this is exactly what 800 scientists came together and wrote to the Honorable Prime Minister, asking that data be made available.
Right. And I don't think there's been any real response to that. But Dr. Jha, in the event that this is not factored into the official count, because right now, as we just said, it's all being done by journalists, others. There's no indication, barring a few states, that they are going to be sort of factoring this in. How much of a setback is that for us?
It is a setback, and I think in the democracy that India is, ongoing efforts by the journalists and others to document what is available is important. I also would make a plea to the governments that it's in their interest to get the confidence of the public that they are using data to inform these decisions, even if they're not sharing it, which I think would be better. If they shared it, you have more hands and more eyes on what are the challenges. But remember, every case and every death in India, pretty much, that is registered will have the equivalent of the Aadhaar information. So they'll know the name, age, sex, PIN code, probably socioeconomic status. And if those data were available, or if the government is using them, then it should convey how it's using them to the public. And that in turn will mean that the public will have more confidence that the government decisions are based on science,
Right.
not on guesses or on politics. So you need the public to come along with you, and that's where open data or saying that data are being used,
Yeah.
showing evidence of it. Everyone in India would distrust the idea that, TK, I've got it under control. When you hear that, you automatically say you don't have it under control. So I think it's a matter of public confidence,
Right.
as Dr. Gill has said, that these data be used and be shown how they're used, or ideally made open.
Right.
They're all there. They're all sitting in one or two offices in Delhi, and they could be released tomorrow.
Okay. Professor Girdhar Babu, I don't know if this is a fair question, but a lot of people have done projections on what actually India's death toll could have been, but these have been done more as kind of reasonable guesstimates. Now that because of the work by Rukmini and others, you actually have some numbers that already just from 5 states, the death count has pushed up, the overall toll could be almost double. Would that give us some kind of ballpark as to what kind of actual death toll we could be talking about? Because right now it's somewhere in the range of 8 lakhs. I mean, again, assuming most of these are COVID deaths. So,
yeah, so I think that's a great question. I would definitely commend the work of Rukmini, Murad, and others who have made the first best step in trying to understand what the reported deaths are. But as I said, this is only the first step. We need to understand what are the different causes of death. There is also data on medical certification of death. As Dr. Jha pointed out, we need to be doing verbal autopsies and death audits. There is underreporting almost in every place, and some places have probably more underreporting than the others. So what we need to do right now is to get the transparency into the system by asking the right question. Otherwise, while underreporting,
right,
we are undervaluing the life of the entire person, and at the same time, we are also making sure that there is no potential for these people who have lost their lives.
Okay.
In terms of getting their.
But you don't want to, at least, not that I'm going to encourage this, but on live TV, you don't want to take a guess at what a ballpark figure would be if we're looking at, it's very hard to say. Yeah.
So let me just put the numbers.
Okay.
If you look at Madhya Pradesh, the reported deaths are 53 per million. The excess deaths are 2,230 plus per million.
Right.
Now, it would be astonishing to say that 42 times higher the number of deaths per million are due to COVID alone. So that's the reason I said we need to have this disaggregated analysis to be able to find out what is the real number of deaths due to COVID.
Okay. Dr. Jamil, you've had your own, how to put it, experience with the government system. Are you optimistic at all that there'll be any reckoning or not really?
No, I am an eternal optimist.
Okay. Okay. So let's hope. Let's hope that increasingly pressure from below, as they say, will lead to some kind of rethink at the top. But thank you all so much for joining me on Reality Check. Thank you so much for watching. Good night.